you that what do you think about this radiology field? Because there is so much dilemma in the people who come from the other countries that it's very difficult to go into radiology field. So what
It's
do
a
you
great
think
field.
about this?
It's a great field. It is competitive. It would probably be like a top 10 or top 15 competitive field in medicine. Obviously, it's certainly not as competitive as maybe plastic surgery, dermatology, orthopedic surgery, but it's a top 10 field in terms of being difficult to get, especially as an IMG. But with that said, IMGs have succeeded. We have IMGs in my program at University of Maryland, School of Medicine, and it's such an amazing, versatile field. It really epitomizes the idea of work-life balance. There's so much you can do, whether you're reading studies, interacting with patients, doing image-guided procedures, biopsies. Really, the sky is the limit for how much you can do in radiology.
Oh, that sounds great, Dr. AWAN. Dr. AWAN, I have also seen you on Forbes. So could you also tell us, like, how did you, how were you able to make it?
I'm doing what I love to do. First of all, I love to teach, and that's my main thing. My main priorities have been teaching and educating the next generation of learners. I do that at my work, at University of Maryland. I teach residents, fellows, med students. I also teach on YouTube, so I have my own YouTube page called MedEdPage, MEDEDPAG. I publish a lot of information on, USMLE tutorials, and also like tips on the match. So like how to interview, how to, mistakes that people make on personal statements and how to avoid them, how to write a letter, those type of things. And part of my education is also teaching about public health and being an advocate in public health. And that's where Forbes comes in. So I really just got lucky. Somebody from Forbes, I was writing some op-eds for some other magazines like the Baltimore Sun, the Baltimore Banner, and somebody from Forbes contacted me and wanted me to contribute and write for them. So I was just very honored to continue that. And I try to write one public health article per week.
Oh, that sounds great. So you have been writing for Forbes from more than a year
right? I would like 5 months. Right. I've been writing for Forbes for about 5 months. I started at the beginning of November.
Yeah, so we are also having some comments. Someone is saying Dr. AWAN is a dedicated teacher. His YouTube channel is awesome.
Thank you so much. Appreciate the kind comments.
Yeah. And also, I want to discuss about, like, what do you recommend to the students who are pursuing radiology, that what they should plan ahead of time, like how they can plan the journey when they're even in their own country.
It's a process. It is definitely a process. It takes thorough planning. It doesn't just happen overnight. So what that means is that it starts with your ability to do well in medical school. So, I think that's worth saying, even though this is obvious comments, I think it's worth saying that you have to excel no matter where you are. If you're in India, Thailand, Pakistan, Turkey, Egypt, wherever you are, you have to succeed. You have to be the best of the best, just like in anything, right? So you want to excel in medical school grades. You want to do as best you can on the USMLE. I know step 1 is pass fail, but that means step 2, trying to ace that exam. And then being involved in research, extracurricular activities, showing your well-roundedness. That's a key part of matching into radiology. Being able to have leadership positions in different organizations and showing that you are going to be a well-rounded physician that will add value to a program. And then the rest of it is really strategic in showing your visibility and increasing your visibility to programs in the United States. And what I mean by that is attaching yourself with mentors in the U.S., writing with them so that they can write you letters of recommendation. A letter from a United States physician is a lot more powerful than a letter from somewhere in India or Pakistan, right? So that's going to be key. And then also is making your presence known physically in America. And what I mean by that is by doing observerships or doing electives in the United States, because once you come here, it completely changes the game. It completely changes the game, because then you're no longer an EROS 8-digit number or an AAMC number. You are a face to them. They know what you look like. They know how you interact with people. They know if you're a people's person. They know whether you're going to be a team player, you're going to facilitate being a great resident and work with the team that is actually at in America. So I think that becomes a game changer if you're able to come, because that not only is your presence seen, you open up your door for opportunities, for so many other opportunities that could come your way.
Okay, that sounds great. So yes, Dr. Wan, we have heard about the radiology field that it's very difficult to get the observerships or externship opportunities if you are the international medical graduates. So do you want to recommend some how to approach people, and then like a few places where the people can go and actually have a wonderful experience?
Specifically about observerships?
Yes, for the observers, because we have received this question so many times that we are not getting the opportunities for although they are getting for the internal medicine.
Yeah, it's difficult. So first of all, I want to say it's difficult. It's not easy, because most places you're gonna email a place, they're not gonna respond, right? I mean that's like 95% of the time that's what happens, right? So you email certain places, no one responds, you get frustrated, and then you keep emailing other places, you get frustrated, and then you kind of lose hope. So a better approach would be, number one, to do your research and see which programs are IMG friendly, which programs have had a track record of bringing IMGs into the program. You can do that by word of mouth, by your friends and colleagues who have matched into programs, and just perusing websites and seeing, oh, well, this person came from Ross University in the Caribbean. They may be amenable to having Caribbean applicants. Or, oh, this person came from New Delhi University in India. I don't even know if that's a university, but I'm just making that up. So, so maybe they are helpful to and amenable to having us here, right? So, doing your own research is a big deal. And the second thing is that don't be discouraged if no one responds to you. That's you should expect nobody to respond to you, right? You should expect that nobody responds, but sometimes somebody will respond, right? So that's the key. That's really the most important thing. And then, I mean, there are some programs, that like at University of Maryland, we try to be IMG friendly. We try to give you guys the opportunities that are necessary so that we want to help. We really do want to. And this is a recent change. Like if you were to ask me 10 years ago, we probably wouldn't have been that IMG friendly, right? But, I think things are changing. There's a big focus of diversity, equity, and inclusion now, where more programs are understanding that maybe it's nice to have IMGs, and maybe we should get that perspective when we're trying to, look and recruit for applicants. So, the bottom line is that you have to do your own research, use word of mouth, use your colleagues that have matched, in U.S. institutions, and try your best and keep trying. You have to, expect that out of 100 people, 97 of them will say no, and maybe that 1 or 2 will finally say yes.
Yeah, that sounds great. And also, since you are also a associate program director in the University of Maryland program, so could you also elaborate like what score percentage of people, what the average score for the radiology residency
I can tell you scores, but quite frankly, we don't cut anyone off. So even if someone has like a 215, which is a well below average score, right? We're not going to not consider their application. We really do a holistic review, meaning that we look at everything. We look at, how do they do in school, their dean's letter, how did they, what leadership opportunities do they have? Do they have a connection to Baltimore? Have they done work with us in the department? All those things matter, but in general, and we don't cut anyone off. Like, if someone has like, oh, they have less than a 225, okay, I'm not going to read their application. That's not how it works here. It does work like that in some places. I'm not going to, I want to be honest. Like, there are certain programs that do have cutoffs, and if you literally don't, if you fall below that number, they likely will not review you favorably, and they likely will not extend an interview to you. But in general, most people who are getting interviews at University of Maryland for radiology are scoring like at least a 240 on step 2. Okay, 240 in general, like on average. I mean, that means that 50% of people are doing above that, 50% of people are doing below that. But I would say the average is in around the 240s for step 1. For step 2. Step 1 is pass fail. For step 2, right? I'm sorry.
Yeah, it sounds great, because if you guys are doing a holistic approach, like not cutting off the candidates, I guess it's more useful for the people who are unable to score exams, but they really have a great CV. And also, I would like to know about the leadership opportunities. You mentioned that you are interested in the leadership opportunities when a candidate apply. So, like, what
So
type
what
of
I mean
leadership
is that,
opportunities
you know, you have leadership in, you know, let's say like the radiology interest group or the student council at your school. You know, you know, you know, any sort of opportunity that you may have, anything really, you know, being in helping hands, you know, doing community service outreach, you know, any activity, you know, volunteering at a student run clinic, health clinic, you know, and becoming, you know, the treasurer, the vice president, something like that, you know, anything that shows that you've developed certain skills and qualities that will allow you to be a leader, because residency is a lot about leadership. It's a lot about working with others to form common goals, you know, advancing ideas. You know, these things are very important and crucial in developing as a competent physician, right? So if we see that you've done this already in other avenues, you know, it gives us confidence that, wow, this person will perform very well and at a high level with others when they're working with others. So all of these things matter. All of these things are certainly positive traits when assessing candidates.
Okay, that sounds great. So here we got one question from Hareem. She's saying, I'm a fellow radiologist from Pakistan. I would love to do a fellowship or residency in the US and in process of getting ECFMG certification. Can Dr. Awan help me connect with any radiologist in New York?
That's a very direct question. So, yeah, I mean, I'm happy to if I can. I mean, I mean, there are a lot of programs in New York. I'm sure I know. I mean, I definitely know radiologists in New York. You know, I can help more in my own institution because, you know, I'm part of that institution. You know, I serve as, you know, the Associate Vice Chair of Education. So I oversee all of the educational programs at Maryland, you know, with respect to radiology, fellowships, residencies, and medical school education. But, you know, yes, of course I can help and, you know, I can put in a good word, but, you know, I can't blindly put in a good word. If I don't know someone, if I haven't worked with someone, it's hard for me to vouch for someone, right? Like if I'm just hearing about you for the first time and I'm go to the program director and say, hey, please consider Dr. X for a position, you know, and I know nothing about that person, it's hard for me to sell that person, right? Because, you know, the bottom line is you have to be able to talk explicitly about the person and why they would be a good fit for a certain institution. So I'm always happy to help candidates. I want to see you guys achieve your dreams. All your dreams are possible, but at the same time, it has to be done with a certain amount of expertise and it has to be done, you know, tactfully, I guess is the word.
Yeah, that's true. I agree. And also, since you mentioned that you are reviewing the personal statement and also as an associate PD, you have been reviewing so many personal statements. So what do you look in the radiology personal statement? I know it's different for the IM or FM, but what do
it's
you
honestly all the same.
think about
it's on Dr.
radiology?
Zane. It's honestly also, I would encourage all of you guys to watch my YouTube video on 5 mistakes that people make on personal statements and how to avoid them. It's on my channel, but really it comes down to just being authentic and being yourself and, you know, making it clear and concise. I always say, try to keep it 1 page. You know, don't try to get too involved. The major mistake that people make is that they talk about experiences and they talk about, you know, they haven't really answered the question. They haven't really shown why they want to go into that field. So for example, let's say you're applying to dermatology, or let's say you're applying to OBGYN. You haven't convinced me that you want to be an OBGYN physician, right? Like you really should be asking yourself, why is it that OBGYN is my only vocation? Is the only thing that's good for me or the only thing that's best for me? If I read your personal statement and I think, well, this person could also be a general surgeon, or this person could, all these things that they're saying also apply to, you know, family medicine, and they're applying for internal medicine. What is it about that specialty that's unique, and how do you bring that to that specialty? That's kind of what you want to bring out in your personal statement. So in the case of radiology, what is it about radiology that is not seen in other specialties, and how am I bringing that to that specialty, and why is it that I cannot do any other specialty? That's what you really want to tackle. That's what you really want to bring out and articulate clearly in your personal statement. If you can do that, then you will have a successful personal statement. But I go into this, I think I have like a 10-minute video on this, and I really try to, you know, explain this in greater detail. And I would encourage all of you guys to watch that video. And if you do watch it, you know, there's no harm in subscribing to the channel and supporting it. So.
Yeah, yeah. So it's Med. Could you say one more time about your channel so people can write it
Yeah,
down
yeah.
and
So
then
it's
they
it's
can
it's it's
subscribe
called
there?
Med Ed Page. It's all just one word. MEDEDPAGE. Med
Okay.
Ed Page. Tons of. I promise you, you guys will benefit from these videos. I do it because I'm trying to help all of you guys succeed. So
Okay.
I'm confident if you go there, you will really benefit from it.
That sounds great. And what do you think about a person who has written in the personal statement that he decided to become interventional radiologist at
That's
the
a
age
good
of
question.
7?
So, it's not bad, but it also will raise some eyebrows because, well, how do you really know at the age of 7 that you really want to? I mean, it's flattering. It shows that, well, okay, this person obviously has passion. This person obviously, and there's nothing wrong with knowing what you want to do at an early age. Nothing wrong with that, right? And in fact, it may show that this person is really focused and driven. But at the same time, it makes you wonder, well, how can someone really know, what they really want to do at the age of 7? Like, I just learned how to ride a bike at the age of 7. You know what I mean? And yet alone, you're talking about your field and not only your field, but your like specific subspecialty. So it becomes really hard to know that if you haven't really experienced and gone through, like, how can you really know how you want to be an interventional radiologist if you've never even rotated interventional radiology, right? As like as a student. So, it
Yeah.
gives us pause and makes us think, well, is this really authentic? So uh, I would probably steer away from saying something that strong and that dramatic, right? But with that said, if it's who you are and you really want to show that passion, go for it. But I think it'll be a minority of people that will really respect that, to be honest with you.
Okay. That sounds great. Yeah. So we got another question here, which is, hi, I am an old IMG, 10 years, visa requiring. What
All
are my
right. So,
chances?
first of all, don't ever let anyone tell you that you can't accomplish something. Okay. So, chances, I don't know your chances because I'm not God, right? Like, I can't tell you you're going to get something, you're not going to get something. But I will tell you this, though. The longer you wait after graduation, so you're saying 10 years, that's how much harder it is to get a field. And let me explain why that's true. So, first of all, it's already hard enough for an IMG to get a field in America, right? It's an uphill battle. Being an IMG, you already have obstacles that you have to tackle before you can get a residency in America. Even if you're a fresh IMG, you've got a 260 on step 1, 270 on step 2. You have straight A's, you're a D, your honors, whatever. It is still very difficult as an IMG to get something. So if you've waited more and more years, we as program directors worry that, well, this person may have forgotten medicine and this person may have forgotten clinical skills that are necessary to be a competent resident. So and the longer that wait occurs, the more we worry that this person isn't going to succeed. So that's why the longer you've waited, it becomes very challenging. Now, I'm not saying you can't do it. Anything is possible. You can be out 30 years and come back and you can still do it and be successful. But it just becomes much harder
Yeah.
and much more challenging. The way you combat that or the way you fight that is by doing things that show that you are still competent. Maybe be a USMLE tutor, working in clinics, showing that you still have the medical expertise necessary to allow you to succeed and thrive in residency programs.
No, that sounds great. Yeah, and also we got another question here, which is, hello, do you recommend doing rotation in internal medicine or general surgery for getting matched at a prelim year for a radiology aspirant?
No, not necessarily. I mean, if you want to do that, that's fine. But I would just focus. It's hard enough to get a rotation in America, right? So if you're gonna do it, then I would do it in the field that you're trying to do it in. So like if you're applying for radiology, try to maximize all your rotations and observerships in radiology in America. It's going to be very hard to even get one. So if you get 1 or 2, you're already ahead of the curve. Now, it doesn't hurt. I mean, obviously, if you have space and you can do it and you're offered to do a 1-month, elective or observership in internal medicine, why not? Sure. But I don't think that should be your primary goal. Your primary goal should really be to do it in the field that you're specifically applying to.
Got it. Okay, that sounds great. And so another question we got here is, what are the essentials to match into radiology? I guess we were already discussing about and what are the essentials the people need to match it into the radiology? And do you want
Yeah,
to
sure. So I mean, I
summarize?
think the prerequisites would include excellent board scores, great dean's letter, excellent performance in medical school, through your preclinical years, your rotations, all those things. Your letters of recommendation need to be very strong. People need to say that you're a team player, that you work hard, you're ambitious, you're able to work well with others, that you have, high IQ with critical and analytical skills to be able to do the work in radiology, to think through differential diagnoses. And then apart from that, it comes down to, showing your well-roundedness, through leadership opportunities, whether you've been a good teacher, a coach, you've written some, peer-reviewed manuscripts with certain mentors. All those things count, right? All those things count. So, and then, then it comes down to the interview. It comes down to, how well you performed on the interview, on the day that you were offered an interview, how well what you say resonates with the people that are interviewing you, and how well they feel that you'll be a solid match in their program. If you can do all those things, and you can do it with a high level of confidence and respect and dignity, I think you'll be successful in radiology.
Yeah, that sounds great. And so, Dr. Awan, since now the competitive nature of most of the residency program in the States, the program directors are also preferring step 3 because step 1 is just pass and fail. So do you recommend doing step 3 if anyone is interested in radiology?
I don't think that's true for radiology. I'm not sure if that's true for other fields, maybe internal medicine, but for us, we did a study, actually. I was part of the study. So we published a paper about, okay, well, we surveyed program directors throughout the country, and we asked, okay, well, now that the step 1 is pass fail, what are program directors going to look at more closely to evaluate applicants? And the overwhelming majority are step 2 scores. So most people don't. The step 3 isn't weighted that high, and quite frankly, 95% of applicants have not even taken step 3 before they're applying to residency. So, it's not a big deal. So, really you want to focus all your energy and efforts on getting an outstanding step 2 score.
Yeah, and also after step 2, they can focus on the rotations and making contacts in the residency program.
That's right.
That's a better approach. Yeah. So we got another question, which is, what about attempts? For example, if anyone have attempt, so is it a possibility that they can?
You mean having like 2 or 3 attempts on the step exam? Yeah. So it becomes harder, right? And so when you let's say you fail a step 2 exam or a step 1 exam, it makes program directors wonder, well, will he or she fail the board exam for radiology, right? Because it's a standardized exam. So we don't want an applicant to be a fail risk. A risk that someone that is not going to be able to, someone's going to go through the residency and then fail the core or the board exam. And then people who fail, there have been studies that show that people who fail USMLE exams are at higher risk for failing board exams and subspecialties. So we don't want to see that. So it makes your job much harder. Like you're really shooting yourself in the foot, especially as an IMG. If you're an IMG and you have failed the step exam, remember, it's already an uphill battle for someone that's amazing, for someone that is a really solid candidate as an IMG. So if you failed as an IMG, it's going to be extremely difficult for a program director to, trust you to come into the program. Again, I'm never saying that it's not possible, because I don't believe in that. I think that you should chase your dreams, and anyone can do anything if they put enough time, effort, and energy and commitment into it. But it becomes exponentially harder for you to match once you have had to do multiple attempts.
Okay. Since you are reviewing so many applications, and so the next question is also relatable, which is how many research experiences are recommended for a fresh graduate?
There's no number. This is the funny thing. I get these questions all the time. People are like, oh, well, how do I need to do 5 papers, 10 papers? No, the answer is, I can't tell you, because it's really about the quality of your holistic application. So, there are people that have done 2 or 3 papers that are high impact, and that show that they're well-rounded and they've done well in everything else, and they match. And there are people that have 35 papers that don't match, right? So it depends on the applicant. But the important thing is to do things. Do beneficial things that are enhancing and bolstering and augmenting your application. You know, write papers. You know, and as an IMG, I think you really do have to write papers. It's hard to make a difference and to show that you're different without showing that you've mastered peer review processes and peer review papers, right? So, you know, I think that it's, you know, you should just do as much as you can. You know, you shouldn't strive for any number. You strive for excellence, and excellence in whatever you do. In writing papers, even if you write 5, that's great. Let's say you've tutored, you've been a master tutor, you've volunteered in clinics, you know, you have, you know, you've mentored, you've done observerships. All those things are going to count, right? All those things are going to count. So don't get bogged down by numbers, but get focused more on the effort and the quality of everything that you're doing. But that doesn't mean not to do peer review papers. Please do them, but don't worry about how many.
Okay. So, for example, if a person has a 40 publication, but he's not able to explain in the interview, then obviously this.
Yeah, well, I mean, yeah, it shows that, you know, they're just doing it, or they're not passionate about what they're doing, and B, you know, well, maybe they just did it to get an interview. You know what I mean? So you really want to do things that are meaningful to you. Do things that you care about, because then if you care about something, you'll be able to talk about it much more effectively, right? You'll be able to, you know, open up about it, and it'll allow you to shine, as opposed to you did it just for the sake of doing it. It comes out when you are articulating it with somebody else.
Got it. Okay. And also another question for the postdoc research fellowship.
It's not essential
to get into the residency?
Nothing is essential, right? So it's not essential, you know, but as an IMG, postdocs can help. And postdocs have helped a lot of IMGs, you know, quite frankly, historically. If we look at, you know, the IMGs that have been successful, like even the IMGs that are in my program, most of them, not all of them, but most of them have done postdocs, you know, at big places like Harvard, Hopkins, you know, whatever. Because what that does is that allows them to write. It allows them to get published. It allows them to, it exposes them to mentors who can then write them letters of recommendation. Those mentors can call program directors on their behalf, saying that, oh, wow, this person was very hardworking. They were diligent. They were able to move projects ahead of schedule. You know, all these good qualities that are necessary for good residents. So, you know, it certainly helps in a lot of ways. You know, it's not, you can get a residency without doing a postdoc, you know, but I think for a lot of people, it helps you get your foot in the door, especially in America, when you aren't able to get observerships. Maybe you can start with a postdoc, and then you can work your way to get observerships and other things that will then eventually allow you to succeed. This thing is a process. It doesn't happen overnight, right? So doing a postdoc can be part of the process to get you to your goal at the very end.
That sounds great. So this will be the same answer for the next question, which is most medical schools are not enrolled within the VSLO system these days. What opportunities should we look for the USCE in radiology, and how can we acquire them considering the scarcity? I think it's the same thing when they acquire a research fellowship, they can make contacts with you by sending the email.
That's
they can
right.
get these type of
that's
opportunities. Right. Well, I guess thank you so much, Dr. AWAN, for your guidance, and I know this is going to be very useful. And also, if anyone wants to know more about radiology, they can reach out to you and subscribe to your YouTube channel to know more about that. And really
thank you, Dr. Zain. Really appreciate being on this platform. Thank you also for all that you do. You know, I think it's worth, you know, calling you out and shouting you out, because you guys are all, you know, helping IMG. You know, this is IMG Helping Hands is a great platform, and, you know, you really are, you know, a voice and a very strong voice for IMG. So, you know, appreciate that on your behalf as well.
Thank you so much. It will actually boost my confidence.
No worries. No, great. Thank you so much for the invite. Appreciate it. Thank you.
Thank you so much, and have a great rest of the day.